Knee pain or knee injury is one of the most common physical complaints affecting people of all ages. Knee pain can range from mild discomfort to severe, debilitating pain that impacts your daily life. There are many important structures in your knee. An injury such as a tear, a broken bone, or a fracture can occur in any part of these structures. One of the most common knee injuries is where the patella or kneecap becomes broken. A fracture can occur in the knee joint at the ends of the tibia or shin bone and the femur or thigh bone. Another common injury is a dislocation of the knee, which can occur when an accident or impact forces the tibia bone and femur bone out of alignment in the knee joint. A knee injury can also be the result of injury, sprain, or damage to the anterior cruciate ligament, the posterior cruciate ligament, or when there is a tear or sprain in tendons. The posterior cruciate ligament and the anterior cruciate ligament are ligaments that crosses within the knee, connecting the shin bone, the tibia, to the thigh bone or femur. These help to stabilize your knee joint. Knee pain can be attributed to overuse conditions, such as runner's knee, where pain can be caused by repetitive strain on the kneecap or by poor movement patterns. Knee pain can also be the result of tendinitis, which is inflammation of the tendons, or bursitis, which is inflammation of the fluid-filled sacs, that reduces friction between moving parts in the knee. In many cases, knee pain can be related to arthritic conditions such as osteoarthritis, rheumatoid arthritis, gout, or pseudogout. Another possible reason for knee pain can be a biomechanical issue, such as poor posture or the way you walk, often referred to as a gait problem related to weak muscles such as quadriceps, hamstrings, or gluteal muscles that can place extra strain on the knee. Another common factor in knee pain can be attributed to flat feet or improper footwear, contributing to misalignments and stress. Other causes related to knee pain or knee injury can be obesity, which increases stress on the joints, infections in or around the knee joint, or age-related degeneration of the joint tissues can be another reason for knee pain. In this video, we will show you what you can do to help yourself straight away. We will show you how to apply energy healing therapy, a heated wheat pack, and a castor oil heat pack for knee pain or knee injury. We'll start with learning how to hold your hands in several positions around the knee to energize, stimulate, and direct life force energy through the knee from a number of different positions. Now our therapist, John Donahoe, will demonstrate how bioenergy healing therapy plus a heated wheat pack can be applied for problems related to the knee.
Rub your two hands together vigorously as I'm demonstrating. This is to help stimulate, activate, and build up the life force energy you have in the palms of your two hands. Place your left hand on your thigh above the knee and your right hand behind the knee just above the calf muscle. Then place your right hand below the front of the knee at the top of the shin bone, and your left hand behind the knee on the inner thigh muscle and hamstring. Then place one hand each side of the knee, directing this life force energy straight through the knee. The aim is to apply life force bioenergy through this area from several different angles, diagonally and straight through the joint. Hold each of these positions for 2 to 3 minutes. Then place your left hand on the left side of your left knee and use your right hand to make circular movements anti-clockwise all around your knee. Continue to use this draw-out technique as you draw your hand away from your knee. This is to help unblock any blocked or stagnant energy. After 2 or 3 circular movements of your hand, shake off and throw away any residue of possible blocked or stagnant energy that you may feel from your right hand and fingertips. Imagine you are gathering up cobwebs and then throwing them away. Repeat these circular hand motions and draw out technique 10 times. You can repeat this complete sequence of techniques as many times as required until the pain has reduced or diminished. Left and right hands can be interchanged. Use whichever hands are most comfortable for you to use for the various positions on either side of your body. I will now demonstrate how you can apply a heated wheat pack to the knee. Place your foot on a stool to support your leg. This makes it easier to apply the wheat pack around the knee joint. Alternatively, you can rest your foot on a pillow or cushion. Having previously heated the wheat pack, place it gently in a curve around the knee joint. You can leave the wheat pack in this position for as long as required. Then place the wheat pack over the knee joint from the thigh muscles down to the shin bone. You can, if you wish, support your leg across a stool and wrap the wheat pack around your knee joint and tuck it in underneath the back of your knee to hold it in position. The wheat pack can be applied outside of clothing or against the skin. The wheat pack will gradually cool down, and when fully cooled down, you can reheat it again and then apply it to the knee joint for a further period of time. The combination of bioenergy therapy and a heated wheat pack can be applied at any time for your own self-healing. The complete sequence of using bioenergy therapy plus applying a heated wheat pack can be repeated as often as required. All of the techniques you will see demonstrated on this healing program can also be applied to you by another person to help you with your healing process.
Now that you have seen how to use bioenergy healing combined with a heated wheat pack to help with knee problems, our therapist, Patricia Heston, will demonstrate how to use the castor oil pack for knee problems.
I'm going to demonstrate for you how you can apply a castor oil pack to a swollen joint for yourself or for anybody else. What you will need for this castor oil pack is 2 plastic jugs, a small one and a medium-sized one, an old saucepan preferably because the smell of the castor oil can remain in the saucepan, cling film to wrap around the joint, as scissors to cut the cling film and also to cut your flannel, a piece of woolen flannel. It's woolen flannel because it helps retain heat. And then to pull up over the knee, once all this has been applied, you can use the sleeve of an old woolen jumper on what I've got here. Earlier, I cut the top of an old woolen hat, which I can use as a sleeve to pull over the knee joint. You can wash and use this sleeve again and again, but it would be advisable to put on a new flannel as a dressing each time. You need elastoplast, and that is to secure all the bandaging. You change it each night, so it's on 3 nights on, 3 nights off, 3 nights on. Your scissors is here to cut your elastoplast, and also you will have already cut your bandage to the proper length. When you heat this oil, you heat it to a point of being hot, not boiling. If you boil it, it's too hot. Then you take out your flannel, you apply it, you then wrap around the cling film, and then you reinforce this and tie it with your elastoplast, and then you pull this up on the knee, over the knee, above and below where the injury is, and reinforce that again with your elastoplast. This is not something you would use during the day because it wouldn't stay on. So it's 3 nights on, 3 nights off, and 3 nights on again. And again, as I said, these little measuring jugs, so it's 3 of them of castor oil and 1 of them of pure spirit. And if somebody is sensitive to alcohol, you don't put it into it at all. You need a support for the ankle, a towel, an old towel preferably, because the oil is going to splash on it, and also advisable a plastic covering. That it can be an old tablecloth, because if you're applying it on the bed, it can soak through the towel or onto the floor and it can be slippy. So these are the ingredients you will need before you start at all. These packs can be applied not on a joint where there's an open wound. You then dip your woolen flannel, you take it out, you wrap it around the joint, above, below, and make sure it overlaps. So you're going under the joint, over the joint, and right down again under the joint. Just to be on the safe side, we're going to put a bit of sellotape onto this to hold it in place. The reason for the cling film is, first of all, it stops the liquid from pouring all over the place. And the other reason for it is it keeps in the heat. So you get your cling film, you go round the joint, underneath the joint. Now, some people will be doing this themselves. And it is actually quite easy to do it yourself on your own knee. Now, be careful with cling film that you don't wrap it too tight, because it can be, if you wrap it too tight or with a bandage, it can be very uncomfortable. So you just need enough to stop all that liquid from pouring off the bandage. So now you get your old woolen, as I have here, a hat, and you pull that up over the joint. Okay, so I'm going to ask this gentleman if he can lift his leg. Just 1 second. And it'll go up nice and easily over that now, because the cling film is shiny. So you have it above the joint and below the joint. Now, and the reason again for using wool is it retains the heat. It's a natural fabric. Then you get your elastoplast, and you could have a wider tape than this one, and you go round the joint and sticking it to the leg, also to the wool, that will hold it in place. So you make sure you could have a wider piece, but you may need to go around it, and I'm not going to stick it on this person's leg because it's not very comfortable. This is usually done at night, so it's 3 nights on, 3 nights off, 3 nights on, and then you can leave it for a month. And don't do it again unless you need to. Approximately 20 years ago, a young man came for therapy. He had swelling in both his knees. His doctor suggested it could be arthritis. He took his medication, but the swelling didn't go down. So after a number of sessions of therapy, we decided maybe we could try, or he could try, the castor oil packs. As he was a plumber, he was kneeling on wet ground, he was in drafty conditions, and he found it difficult to bend his knees. It was more the bending than actual pain. So he tried the castor oil packs, as in 3 nights on, 3 nights off. The decision was we'd leave it for a month then and see how he got on. The swelling went down and it never came back again. So he was fine. It did work for him. So this is something you could try for yourself or for somebody else.
There are a number of other options available to you to further help with any problems related to your knee. It is important to allow time for resting your knee and your overall body. It may be time to look at possible lifestyle changes you can make. For instance, maintaining healthy weight through healthy eating can help reduce stress on your body and on your knees. There are anti-inflammatory medications available, or you can use cold ice to help bring down the swelling and reduce pain. Stretching exercises can improve flexibility in the surrounding muscles and ligaments of the knee. And physical therapy and strengthening exercises could prove useful, but avoid high-impact activities if they aggravate the pain. You can also avail of low-impact activities like swimming or yoga. Wearing supportive shoes with good arch support is also very important, and orthotics or shoe inserts can sometimes correct biomechanical imbalances. Mind-body practices can also be useful, focusing on body awareness, intent, thoughtfulness, and empathy towards yourself. Deep breathing exercises, like diaphragmatic breathing, can help you relax and reduce inflammation-causing stress hormones. Chanting mantras may also help by creating your own healing vibrations throughout your body, which also helps to rebalance your chakras and energy field. Autogenics or autosuggestion, audio recordings, and progressive relaxation techniques can help to relax the overall body. Vibroacoustic vibrational healing, using binaural beats at low frequencies, 40 to 80 hertz, may be helpful to promote cellular healing. Finally, mindfulness meditation can help you to be present and manage the emotional stress associated with long-term pain. In conclusion, healing from knee pain involves a combination of approaches, such as identifying the cause of the problem and addressing physical, emotional, mental, and lifestyle factors, and, if needed, incorporating professional care. With a holistic approach, you can reduce pain, regain mobility, and restore good health and wellness to your body. We would advise that in health-related matters, you seek the attention of a healthcare professional. We hope that helps. Watch out for our other self-help videos in these series. If you like the video, please consider liking and subscribing, and let me know how you got on in the comment section down below.